Okay, here we go. Hello, all. Welcome to the first part of the three-part success series. This is a collaborative effort between the business development crew and the leadership and service crew. I am Bree SEGOVIA, the crew leader for business development. And then I have my co-crew leader, Stephen Elias. And then we have our crew leader, Monique, and her co-crew leader, Naomi. This is going to be a great series because we are going to look at what and how to succeed in 2021 with COVID and how COVID has changed processes with companies originally had a process and really knew how to work things, but because of COVID, they had to change and arrange how it worked. And so we had to differentiate and adapt. So that's why we are looking at three different industries and seeing how they work. And I would hope they would introduce yourselves. We have the healthcare and service with Renee. And then we have the higher education with Tori. And then we also have the hospitality with Jared. Stephen, if you would like to start things.
Sure. Thanks, Bree. And I'll also kick it off to Monique and Naomi if they want to say anything about leadership and service. One thing before we get started, this is an amazing collaborative event. Business development crew and leadership and service have always tag teamed on this one to make sure that we bring really thought-provoking content to our members. Everyone listening on Facebook Live, as well as people here in the room. I'm excited about this one because I think we've heard a lot about COVID, but it's time to start transitioning into what's going to be staying, as well as what skills do we need to be adding to our repertoire in order to succeed moving forward. And so we're going to really explore that tonight. I can't say enough about these speakers. Just seeing the resumes speak for themselves. But again, before we get into introductions there, Naomi, Monique, anything to say?
Just that we're thankful for this collaboration with the business development crew. It fits in really well with our leadership and service focus of professional development, and we're just really excited to hear what our speakers have to say tonight.
Awesome.
Thank you, guys.
Of course. Well, quick ground rule. Anyone who has questions, we have a small crew right now, but I'm sure we'll have people trickle in. Save your questions towards the end. We will have open Q&A for anyone who has any burning things that we want to ask our three speakers. But make sure you write down those questions so you don't forget. Hopefully we'll cover a lot of what you do want to learn. And then without further ado, I want to get started. So I'm going to kick it off. We'll start with Jared. Give a quick 1-minute elevator speech about what you do, talk about the Summit Club, and then we'll go to Renee and then Tori last.
Okay, thank you guys for having me this evening. My name is Jared Jordan. I am the Chief Executive Officer and General Manager of the Summit Club in downtown Tulsa. And what do I do? Well, for the last 12 months, I've mostly been under construction and trying to keep a restaurant afloat through the pandemic. But yeah, the Summit is a private club founded in 1967. We've been in the Bank of America building downtown for right at 54 years. And, we do private events, fine dining, and we actually launched a new concept in the middle of all this year that is a more relaxed dining concept. So that is what I do.
Awesome. Renee?
Good evening. Yes, I'm Renee Engleking, and I am with OU Health Physicians in Tulsa. I'm the Executive Director for Clinical Operations, and I like to say what that means is I'm responsible for all of our outpatient practices, And I work for our teams that are there to take care of patients. I just want to say quickly, you know, I've learned over the years that OU Health Physicians in Tulsa is one of the best kept secrets in Tulsa. And just so that to make sure everybody kind of is on the same page, we are a statewide academic health system. We have the largest statewide network of primary care, specialty care, and subspecialty physicians across the state. And you know, our focus, while our faculty are our physicians are faculty and professors in the School of Community Medicine, they also run their medical practices, and we see patients all over in all of our practices from all walks of life. So I'm glad to be here with you tonight.
Glad to have you. And then Tori finishes off. Can't tell if Tori's frozen.
I think I froze for a second. My apologies.
No problem. Hey,
You're all
I think
good.
we've all gotten used to Zoom technicalities, so you're good.
That's true. At least I was unmuted. My name's Tori Burris. I'm the Career Services Representative at Holberton School, Tulsa. We are new to Tulsa. We opened up in January of 2020, right before the pandemic started. But we are part of a global network of schools based out of San Francisco. What we do is we're a software engineering school that's about 20 months long. We have no teachers, no lectures, and no upfront tuition. So both our education and our funding model look really different than traditional higher education. What I do in my role is I basically oversee and represent our career services department to our 100+ student body and the local tech community.
No, extremely exciting. And I see news about all three of these organizations a lot, either in periodicals or Tulsa World. I can't say enough about the amount of things that these organizations are doing here in Tulsa. So that's why we thought this would be a really good swath of industry leaders to talk about what they're seeing in their sectors and then what we can learn from it. So with that, we're going to start off really quickly, just talking about the individual industries that you're in and give a quick overview on how COVID's affected it. I know that we've heard this a lot and we all have a general idea, but I think you can't hear it enough, especially with people who are as intimately involved with these as you all. So Renee, I'm actually going to start with you. Your school, like you had mentioned, emphasis on serving all sorts of people, all walks of life. And with COVID, that certainly has brought up a lot of discussions about like how do hospitals effectively treat everyone, right? With equality, with all sorts of means. Do you feel like COVID has brought the that emphasis to the forefront, or has this been more of a headwind to achieve that mission?
Let me see if I'm not sure I understand your question. The mission to provide the healthcare to all folks. Yeah. Well,
Yeah.
like you probably saw in the news early on in the first probably about 4 months, most healthcare facilities, us included, kind of shut down to all but essential services. So things that often are considered elective, but or not urgent, but certainly impact people's health, were delayed. And so I think that, you know, there's been a tremendous emphasis in recent years on preventive services and screenings to prevent cancer and things like that. And most all of that shut down for 4 to 5 months. And so we are concerned we'll start to see rises in cancer rates and things like that. But we are pretty much back to, you know, we've had challenges throughout, but we are continuing to provide essential services, and we're back to offering more preventive services within our practices.
Yeah. And as a follow-up, and apologies, that question was a bit of a two-parter. Do you feel that COVID brought to the forefront this idea of healthcare for everyone, or do you feel like it's been a bit of a wake-up call and a bit of a headwind to provide all those services? I know you touched on that a bit, but
Yeah.
could you explain a little more on that?
Yeah, well, it's hard to say, Stephen. I mean, you know, those of us in the industry know that, you know, that emphasis and where we're trying to go. But it has certainly highlighted disparities and access. You know, one of the questions I ask our new staff coming in, and I don't ask them to give me an answer, I just ask people to contemplate the question, and that is, do you believe healthcare is a right or a privilege? And, you know, it's just, I don't want to know people's answers, but I think that drives the question that you're asking. And we do know that access is not equitable. And I think it probably has been highlighted, both because of availability and also in some communities and some populations, a lack of trust in the healthcare industry.
Yeah, no, that's interesting. And I'll leave it at that. And by the way, you by far have the toughest first question for our three speakers. It's not an easy question, and there's no, I don't think there is a right answer, and we're still evaluating all that. But it's certainly something we had to ask, considering COVID is in fact in a health epidemic. So
Absolutely.
You passed the first question. Well done.
Yeah.
Tori, we're gonna move on to you. So you touched a little bit about Holberton School. It's an interesting model, especially with no upfront fees, like you had said. And I don't want to sell it for you, but I do want to know one thing: virtual learning versus in person, right? We're doing virtual events right now, and everyone can say there's increased access and things like that, but then you also hear the naysayers say it's not the same type of learning. What's your opinion on the efficacy of learning remotely?
Yeah, I think it's been really eye-opening, and I think there's been definitely, like you mentioned, value adds on both ends, right? There's a lot that comes with, especially the way that our school is structured. It's really heavy on collaboration and peer-based learning. And so in doing so, what we've really learned is that you need a different skill set to do so in a remote world, right? Because the real key is that when we switched to remote learning, what we lost a lot of was observational learning. We lost the ability to look around and have our students look at what older cohorts were doing that had joined the program before them and start learning from watching them, right? So being able to think about how we've switched remote, I think there's been certainly moments that have been challenging for all of us and eye-opening. But one way that we feel as a school that I think has been really fortunate for us that we've been primed to do was to adapt the structure of our learning, because we already have a pretty flexible and unique learning environment. Being able to say, okay, because our students fund a percentage of their education through their income upon graduation, that means that not only are our students consuming our curriculum as a product, but in a way our students become a product that then we as a school have to sell to employers, right? And so this is something that like the higher education system as a whole, I think could benefit from, because it really makes us look at the financials and reprioritize the ways that we are focusing on learning.
Yeah, no, it's an interesting dynamic, and I certainly have my own opinions on what it's like to try and disseminate information and make sure it's retained over Zoom versus being there in person and making that connection. And so, not an easy task. You all are doing great work. And then I'm gonna move on to Jared. You're gonna finish us up on this content. What new so fine dining, right? Entertainment, that clearly has taken, I would say, the brunt of the longevity dollars going into the industry, right? You can talk about hospitality and you can talk about all sorts of things in the entertainment space. It's not been easy. Obvious question: what have you had to do to adapt to make sure that customers are still wanting to show up and risk? You know, but surely it's a calculated risk showing up. And what have you had to do and make sure customers are still coming?
So that's a good question, Stephen. You know, this whole thing has kind of been a moving target since the beginning. And, you know, I will I remember very vividly St. Patrick's Day 2020 because that was the day we all found out we were shutting down the day after that. And that St. Patrick's Day, I was actually sitting at McNally's at the bar with Elliot Nelson, just kind of sitting there and going, what are we going to do? And then we shut down for a couple months. And the first big challenge was, really trying to get our hands on some information about what this whole thing was, how it was transmitted. And because really you can't sell what we do, which is food and beverage and events and things like that. And keep in mind that we fall largely in the public health realm as well. In order to open back up, it was really quite a challenge to just be able to figure out and determine what are the rules now. The rules had completely changed. There was a lot of communication, a lot of coordination with the Tulsa Health Department and Oklahoma State Department of Health, just to figure that out. And then once we got back open, PPE. I mean, we had to have all of our employees, in pretty much full protective gear, disposable menus. The list goes on and on. Table spacing, and just general interaction with guests. And when we did reopen, I think the biggest challenge we faced, however, was really public perception of what this whole thing really meant to them. We have a pretty diverse membership at the club, and that ranges everywhere from people completely afraid to come in, period. I mean, I've just seen certain members that we've had that have not been to the club physically in a year. But we also had people who were very cavalier about this entire thing and didn't believe that all the measures were necessary. So PR and messaging and just, the image of what we were putting out as a product was the biggest thing. I mean, we also had to grapple with, do we go convert into a takeout place? There was a lot of coordination legislatively with getting us to be allowed to sell wine and alcohol to go, which was, if you think about the liquor laws 5 years ago in Oklahoma, it's like the Wild West now. We pretty much have carte blanche to do a lot of things, and have made some of those permanent. So those were, I think, the biggest changes. And a lot of that stuff is still with us. I mean, we still are under some pretty serious regulations as far as how dining rooms have to be spaced out. But I would say just navigating all those changes and putting out the public perception that we were a safe place to go was the biggest challenge for us. So.
Yeah. No, and that's a perfect segue into this next question, I think, which you alluded to it. Some members, you haven't seen them set foot in the club since, I think it was about a year ago that things started shutting down, right? Around this time in March. And then some have been very cavalier. On this, what's been the biggest surprise to you since COVID has started and you've kind of gotten to the swing of the new normal? What's been the biggest surprise for how your employees have reacted and how your customers have reacted to all this? And just a quick blurb on that.
Speaking directly about the club, I mean, the amount of determination and care that our staff has put into executing the plans that we put together. The service industry is a pretty tight-knit community. So at the club, I would say just the fact that our employees hung with us and worked through everything with us. And it was very positive thing. We were able to retain our entire staff throughout the entire ordeal. So that's been very prominent. We've actually added about 15 new positions since we reopened, which was a good thing. And then overall, just industry-wide, how everybody came together to just try to navigate all this. I mean, there were a lot of people, who, like I said, are cavalier, and we've seen industry-wide kind of a strange shift in people's perceptions of restaurants and how they handle this whole thing. But, through mostly sheer grit, determination, and a little bit of magic, I think we've gotten through to this point. So.
Yeah. No, that's that speaks volumes to be able to retain that level of the employees and even to grow. So well done. Renee, well, same question to you. Biggest surprise that you've seen your, I guess I should say patients, not customers, patients, as well as your employees through all this. And I can safely say again that this has been a tough time. My sister is an emergency medicine physician up in Ohio. And if there's someone who's really stressed out these days, it's been her. So I've seen it firsthand on how this has affected people.
Yeah, it has been tough. You know, I have similar experience to what Jared explained. You know, I've been probably most, not surprised, but delighted by the way our staff have pulled together, teamwork, very little, you know, not crossing boundaries, basically we'll do whatever. You know, we were very fortunate that we were able to also retain all of our staff. And actually one of our biggest challenges is enough staffing. I mean, I think everyone is aware there's healthcare professional shortages. And then when things like this happen, they become even more pronounced. But we were able to, we switched all of our, I have about 250 to 300 clinical support people, nurses and receptionists and so forth. And we put like an A and B schedule together so that we cut down to about half of our schedule so we could space people out. You know, we have to deal with newborns coming in, which are very susceptible to infection, and pregnant women, and not commingling them with sick people. So we were having to redesign entrances and ways for people to come in and out of the buildings. Of course, you've seen we restrict visitors, and that doesn't make patients and their families real happy, but we had to do that. But I think probably, you know, just the way our staff have pulled together and continue to do that. Like I said, we were on an A and B schedule, so we were running about half of our schedule. And then for at least, I believe it was 8 weeks, maybe a little bit longer, we brought in lunch for every employee that was working. Because there were so many restaurants shut down and so few places to get food, and so many of our staff members are entry-level type folks that have challenges at home, a lot of mouths to feed. And so we felt like it was important. So we provided individually packaged lunches for, like I said, at least 8 weeks for our staff while they were coming in to work.
Wow,
So
that's
we've been
impressive.
able to keep folks, and yeah, we were happy
Yeah.
about it. And we didn't put it, when people weren't working, when they were on their off schedule, they were still being paid. So nobody was harmed financially.
Well, for people who are working those crazy hours and having to deal with everything, that definitely seems warranted. I have been asking for that forever at my desk job, but that just has never seemed to really stick. So still fighting the good fight there.
You weren't working as hard, Stephen. That's the thing.
And then Tori, we're going to finish it up. Same question to you. What's been the biggest surprise for your students and then your faculty?
Yeah, so I mentioned earlier that we really lost the sense of observational learning and just being around one another and sensing how we're doing. What we saw with that was a real increase in imposter syndrome, because you're seeing people when they're on video calls. You're not always seeing them when they're at their most challenging points. And so I think that is one fold of this, but there's a really, I think, exciting second fold. And I have to give the kudos to our students on this, because I've been so impressed with how resilient they are, that students and people are really resilient. And they become incredibly resilient when they see the light at the end of the tunnel. So what's been interesting for us is that we take 3 cohorts a year, which means that we've taken 3 cohorts since we've been working remotely. In our first cohort that we took remotely in June, we were at a place in the world and in history where we didn't really know when the pandemic would end. We didn't know what the future looked like. We just didn't have a picture of that. And then we took another cohort in September of 2020. And this is a time in history where we felt like, okay, we kind of have an idea of when we might have a vaccine rollout. We knew it would be our reality for a while, but it kind of felt like there was that light at the end of the tunnel. And I think we've been able to see in the difference of those students' experience how having that light at the end of the tunnel has really impacted them.
In a positive way, I assume?
Yeah, in a really positive way. I think it just comes down to, the environment that people are put into, right? And not knowing if it makes it really hard to focus on school when you feel like you don't know what the next day is going to throw at you. But if you have that light at the end of the tunnel, we've been really impressed with how much students have really dug in, and despite some of the more challenging circumstances we've all been in, have had that resilience and that grit and really pushed through and said, no, I'm going to do this and I'm going to do it now.
Yeah. No, I think across the board, it's really been a testament of the human spirit. In any industry, you'll find those workers that are doing that. So it's awesome to see. And I think that's where we'll end up this conversation, and we're going to transition just a little bit into the industry and then touch base again on those skills that what are the leaders had to build, what do employees need to look to build on their resumes and their repertoires in order to really stay ahead of the curve. So we've talked about the changes that your industries have gone through, for better or for worse, right? That this is the way things are. We're talking about the light at the end of the tunnel. So assuming that there is an end to COVID, whatever that looks like, these changes that you've discussed, what's there to stay? What's a temporary change that is just purely situational? And then what really has morphed the industry permanently moving forward? We're going to zigzag back again. So Tori, lead us off.
Yeah, actually, for those who are not in the Zoom call, one of our students is on the call and put something in the chat about how it's been difficult to not be side by side with peers, but the environment does really work in a virtual world. And I think that, you know, I'm not going to pretend like I know what a year from now looks like, but as staff, we've definitely had to grapple with what's the pathway we build to allow students to be side by side again with peers and to be standing up at a whiteboard, figuring out problems, being able to bring companies in for fireside chats and have an in-person audience, because there's a lot of great skill sets we've learned over the past year, and it would be silly to just move past those. So it's some sort of combination of thinking about how many skills have we built, how much have we grown, what professional soft skills have our students had to build with their digital professionalism, with their remote hygiene, and that they are able to maintain those, but also find a way to safely integrate. And, you know, it's something we have to discuss constantly as a staff.
Yeah. And follow-up question on that, do you think that virtual learning will continue to improve? And this is kind of a bonus question, I'm interested to hear your answer. What enhancements do you think that these virtual platforms will implement over the next 12 months?
Yeah, I think quite a bit of virtual learning is going to be here to stay. We've gotten a lot of mixed feedback, to be honest. There's a lot of people that love the virtual working world. They want to learn virtually, they want to work virtually, they want to sit on the rooftop and take class, and collaborate with their peers all day. There's also people who are itching to be back on campus, who are itching to be standing up at a whiteboard in a group of peers, problem solving. And I think what we've had to think about as we're preparing these people for the workforce that's really interesting is, you know, the skill sets that have been required to be successful in the working world, particularly as a technologist, have shifted in many ways, because technology is a very collaborative industry. And so as they've shifted, they've also had to be reprioritized. What are the most important skill sets you have? And our students have had to do the same. And so I think a lot of that remote opportunity will remain in education. At the same time, there's just no substitute for being in person. And we all can really feel that right now. There's no good equivalent remotely. And so I think what we'll find is a lot more opportunity for people to pick and choose what better fits them as far as education. Yeah. And I'm sorry, would you repeat your follow-up question?
No, it's okay. And you touched on it there a bit, but do you think that there's going to be any major enhancements, continued enhancements to a virtual platform if it is here to stay?
Yeah, and I think we've seen a lot throughout the course of this year. 93%, they say, of communication is nonverbal. And so, like, going back to what you said earlier about things our staff have been really surprised about, we can't pick up on when a student's having a bad day, when they're feeling excluded, when they're not doing well, when they're showing up late consistently, because we're not in the room with them. So as we haven't been able to pick up on body language and things like that, we have to think about, okay, what are ways in which we are able to start connecting with one another in a virtual world that is really conducive to bringing your whole self to work or bringing your whole self to school. And so I think some of those additions or changes will come about in ways of creating more of a sense of connection digitally. Trying to create any sense of connection right now feels really important. And we've noticed that school and the educational setting has become a place people have come not just to learn, but to be around one another, to be creating a sense of community, to felt like they're being cheered on. And so I think that will be even more emphasized in the tools that we're using.
Yeah, I can safely say I agree. I think for us to be able to do what we're doing here, we've certainly made strides. If you would ask me a year ago if you could do virtual events this successfully, I would have told you no. But it's really forced our hand. I think we've grown for the better, but it'll be interesting to see what, again, 12 months from now holds. I don't think anyone has a crystal ball for that. Renee, same question to you. And I think as far as reorganizing and shifting around and changing with protocols from a health perspective, what's here to stay in the healthcare industry, do you think? And what does that look like even in 12 months, if you could give your best guess?
Well, definitely virtual. We've heard a lot about virtual learning, but we pivoted to virtual visits with our patients and physicians fairly quickly. In January of last year, we had just signed a contract with a virtual healthcare visit company, and we had just started piloting with a couple of our behavioral health specialists those telehealth visits. So we went from doing 3 or 4 or 5 practicing to 200 or 300 in days. And I can say that, one of the things that's interesting is that we do survey our patients after each visit, and we have higher, you guys are maybe familiar, they use this in a lot of industries, net promoter scores. But we have higher net promoter scores in our telehealth visits than we do in our in-person visits, which tells me that patients want that as an option. So I don't see that going away. We won't ever be totally virtual, and not every specialty can do that. But for example, all of our psychiatry visits are now virtual, and honestly, our no-show rate is much lower. Patients seem to be happier. They don't have to leave their home and come to the doctor's office. And so I don't see that going anywhere. In fact, we are continuing to build and enhance our virtual platform for our patients so that we'll have virtual urgent care, virtual plan visits, all sorts of things like that. The other thing you're going to see, and it is somewhat related to COVID, would have been extremely helpful early on in COVID, is in healthcare in general, a move to more transparency and interoperability. So, the idea is that as a patient, your records should all be accessible to anyone who's taking care of you and accessible to you. In fact, there's a new federal legislation that's going into effect over a course of a few months right now, called the 21st Century Cures Act, and it requires that your records be immediately available to you through a portal. So your lab results, so this is just continuing to expand on where the industry was going as a whole. What I'd like to think will go away is the plastic barriers between everybody. But because we did have to make a lot of structural changes in our clinics to put up, and in fact, the college, I think it was, I forget which college in Norman, made all of our barriers on 3D printers and put them into all of our clinics. And it was a massive undertaking. So that was pretty cool. But I think, fortunately the trends in healthcare were moving in the direction that we're supportive of the things we had to do with COVID. So I don't see us going back. And, I tell our staff all the time, and my managers, I'm not a rear view mirror person. I don't want to say, well, what do we need to get back to? I want to see where we need to go in the future. And so that's kind of the approach that we're taking.
That's really interesting. Several insights there. I think the most surprising one is that the Net Promoter Score went up, and I suppose that is telling that there are certain people who really do just dread going to the doctor's office, but more from a physical standpoint and less from a they don't want the service. So that's interesting to hear. Okay, Jared, you're going to wrap us up on this section. What do you think is here to stay, and what do you think was temporary or hope is temporary?
So I think the number one thing that we're going to see stay, I hope industry-wide this is more of a practice. Internally, we've always had pretty strict health protocols, wiping down menus, all of that kind of stuff. I think that you're going to see a lot of dining rooms not cram all the tables back in. I realize that those are revenue centers for everybody, but a lot of people have become very accustomed to not being jammed in right with somebody, and I think that will probably be something that stays. A lot of the cleaning and health protocols that we've implemented really for COVID, but I think are just good best practices in general for the industry, will probably remain. And from a health perspective, I'm very much an advocate of that. As far as things that are going away, I think our number one hope is masks. Running around a restaurant, for 7-8 hours masked, not only from just the whole perspective of, you're in one, but one of the things that we've noticed that has made our jobs very difficult is the fact that you can't, facial expression is such a emotive way to communicate with somebody, and especially in a dining setting, our members and customers have a very hard time reading what we're trying to. People can't see you smile, they can't see you, so it's made the communication barrier very, very difficult, and it's something that, we haven't really talked about a whole lot, but internally it's something we hear all the time. People just kind of misunderstand what you're doing, and communication kind of breaks down without the facial cues. Other things that I think are probably going to go away, I think that people's being averse to going out in public obviously is already, we're starting to see more people getting out and things like that. And I think that as vaccinations continue, people's trust in the public health is going to be better. I can speak to our staff is about 30% vaccinated already at this point. So we anticipate that we'll probably be close to 100% in 3 to 4 weeks. So that's something, and I think that eliminates a lot of the anxiety just among the staff in general, because that's just one of the things that we deal with on a daily basis. So those are the major things. I think that people are probably going to be a little pickier moving forward. Everybody's kind of given everyone a pass, for the last year, but I think we will see the people returning to being a bit more picky about what they want from us as far as a restaurant goes. So I anticipate that going away as well. So.
Yeah. And I will also ask Jared if you could scoot up to your microphone just a touch. I am hard of hearing.
Sorry.
But hopefully everyone else could hear that. So, and we'll let you recap all that if anyone didn't catch it. But all interesting answers. And what I'll say is, this is now the part of the question set that I'm really interested in. Hopefully everyone else is focused on, right? From a selfish standpoint, as employees, right? As workers in this crazy rat race, I think we're all focused on how to survive this, but then also what do we need to do moving forward based on your answers of these are what these industries look like, and whether we're working in those or not, we'd like to succeed as humans. So first, I'm going to start this one off. Skills wise, as leaders, what have you had to really develop? Give us a top answer. What's the one skill you had to develop and get really good at that maybe you had been lacking or just really didn't need prior to COVID, and then suddenly it hits the fan and you need to have that honed in? I'm gonna open this one up to either three of you to answer first.
I'm happy to try to take it. I don't know, Stephen, if it'd be something I didn't have, but when I read this question, my first thought was stay calm. Somebody has to stay calm, and you know, I know that's that cliche, you know, stay calm and carry on, but really that's what your teams need. And, you know, for me, it's stay calm, ask questions, get the facts as best we can, and then make decisions. They want people to make decisions. They want to know they're safe. And, you know, we did also ramp up communication. You know, like a big organization, we have, you know, 7 or 8 different departments, clinics, managers that run them. But we started having weekly leadership meetings where we could communicate, because we were literally changing protocols in the beginning on a daily basis. This flow of patients didn't work. We're going to switch this. So actually, when we started out, we were meeting 3 times a week at 4 o'clock every Monday, Wednesday, Friday to go over anything. So we ramped up communication, and you know, there's so many unknowns, but at some point you just have to gather as many facts as you can and make decisions that'll guide your teams in the direction you want them to go.
Yeah. So staying calm. Okay. I'm going to keep that. I'll keep that in mind next time that I'm trying to get any healthcare. And I'm like, oh, what's happening? I can't get in there. Same question. Either Tori, Jared.
I would echo some of what Renee said. Communication just to our staff, our customers, has been kind of this ongoing constant. I think that patience has been a big thing that I've had to learn. You don't always have the answer, so you have to go. There's been a lot of research involved in this entire situation too. I mean, the amount of reading, not just from a health perspective, but legislatively, you know, just staying on top of information and then disseminating it to everybody to where it's, you know, discernible, has been one of the skills I've really had to tap into. The other one is human resource management, which thank God I have a fantastic HR director, but, you know, just making sure that everybody, you know, always has what they need from an information standpoint. You know, during our shutdown, we really made a huge effort to try to make sure that all of our employees really had everything they needed while they were at home. Yeah, obviously, we didn't know when they were coming back or what was going to happen, but one of the things that we set up during the restaurant shutdown was basically my management team. We kind of had a phone pool where you would, you know, pick 10 employees and call them on a daily basis and just make sure they were doing okay. You know, dealing with everything and also to, you know, keep them in the loop as to what's going on. So information and communication was the two main things for us. So
I'm seeing some similarities there. So yeah, I think that's telling. Tori?
Yeah, I would echo a lot of what they say. So I would kind of frame it this way, at least for our organization. We're a small staff, and the way that we manage our students is like similar to how you would maybe manage employees. So it's kind of like having over 100 direct reports. And so a big part of that has been, like I mentioned earlier, we aren't able to see everyone in the same room together and observe how they're doing and pick up on those body languages and cues from people. And so it's really required us as staff to be super intentional about creating space for people to be vulnerable and share those more challenging moments with us in the amount of time they have with us. And so a big part of that, of creating that space to be vulnerable, has been being really transparent with them, like transparent, really empathetic, and finding this balance between right now, how are you pushing people to do their best and to keep going despite some of the things that are thrown their way, in conjunction with being really empathetic to the reality of what is happening in people's lives right now and how it's impacting them personally.
Yeah. So communication, a little bit of empathy there, staying calm, patience. So as a leader, and we actually have some leaders on the phone here too, and so those are the big takeaways there. Hopefully I summarized those correctly. We're gonna flip it around a little bit for your employees, or your staff, or your students, for instance. And this is a time to really open up to us and say, hey, if you had one piece of advice for your employees or your staff or your students, what would it be? What skills do they need to learn in order to really, put themselves above the rest in this new model that you're working in? And I'll open that up to, again, same format. Anyone can answer this one.
I can say one thing that we've said to our students a lot. We actually were saying this to them before the pandemic, but it's become particularly relevant right now, which is like, you have to opt in life. Things don't just land in your lap most of the time. You have to actively seek them out. And now more than ever, you don't just bump into people you've networked with on the street anymore, right? You have to be so cognizant and intentional about reaching out, opting in, driving your own experience, whether that be educationally, professionally, whatever that may be. At the end of the day, you're really the only person that can drive that. And so that's been a big one for us.
Yep.
I mean, for us, I think the biggest thing that we have found, and this is another challenge of the pandemic, is that we've actually lost a lot of our labor pool over the last 12 months. A lot of people have left the service industry for good and probably won't be coming back. So what we ask a lot of people as we're interviewing right now is, are you a career service industry person, or, what is your long-term goal with, being in this industry? And we tend to try to only hire people who are wanting to make a career out of this, as opposed to someone who's just doing it, part-time while they have other goals. So.
Yeah.
I think for us, or advice I would give anyone going into, especially a new industry, is, be open to learning, be flexible. It's interesting how many folks we hire that come in and they really want to tell us what they want to do rather than what we need them to do. And so, being flexible. And then I guess probably the one thing I think would be helpful is, I didn't say this when I started out, but I am a nurse by training. But one of the things I did early in my career is I tried to learn everything I could about the business of healthcare. A lot of people go into healthcare, they want to take care of patients. I did too. I say now I'm a healthcare provider. I take care of healthcare people who take care of patients. But you have your niche in your business, but the more you can understand and know about all aspects of that business, the more versatile, the more benefits you'll bring to the employer and value, and you'll be recognized for that. I just encourage people, get out of your niche, ask for opportunities, ask why things are done the way they're done, and make yourself a really valuable asset to your employer.
Yeah, and I think Naomi agrees, that's an awesome point. And it's something that a lot of younger professionals will hear is be curious and be open to learning and adapt. But certainly during COVID, I can speak of this personally, it was put your head down, do your job. Everyone's just trying to survive this and we can do it together, but, become very, put your blinders on and kind of go about your day. Now I think people are starting to open back up. So that's such an interesting point to hear about being curious again and going out, because it kind of runs antithetically to what we've been told to be safe. So that's very interesting.
Well, I would add to that, Stephen, if I could, to, as I said, to be open, but I think I lost my train of thought on that. I was going to add something, but I'm sure it was profound.
It was very wise. We believe it.
Well, if you think
it'll come back.
Yeah, if you think of it, let us know. But
I will. Go ahead and move on. Yeah.
Yeah, exactly. So this is a kind of a thought-provoking one, but flip the side of the coin. We just talked about skills that are necessary to really adapt. Name one attribute, and you don't need to call anyone out, but name an attribute in your line of work that was very detrimental during COVID. like an attribute to really just try and work on. If you were to point out a weakness that someone needs to say, hey, build this one up because that's your dragging point, what would it be?
I think for me, complaining without solutions.
Yeah.
And what I was going to say earlier is, came back to me, is, be available to your managers to offer solutions when people come to you and ask. I'm a big believer in bottom up, and people that are doing the work know, what work needs to be done, but also as a leader, and you mentioned there are several leaders on this call as well. I think you have to demonstrate that you will be right there beside them. When this started, and this is a little sidebar, we were mandated to open a public testing pod. So the governor wanted the universities to do that. So we had to stand up a way for the public to come through and be tested. And, I got that call on a Wednesday night, and we were supposed to be up on Friday. And so myself and my associate director, we were the ones that started it. We were out there swabbing. We set it up. We ran through all the protocols so that we knew what we would need to have. And your staff see you doing that, and they see you pitching in, and they see you being there beside them. And so those of you that are leaders, I would really encourage you to be out there with your staff and showing them that what the work takes and that you're there for them.
Yeah, no, great point. Tori, Jared, anything on that?
I would echo a little bit of what Renee said, and the fact that one of the biggest things that I personally learned as a leader throughout this whole thing was to really listen more and be more collaborative with the staff. We do a lot of discussion, and our business model and the way we kind of run things isn't really, well suited for someone that's kind of a lone wolf or wants to act on their own all the time. But I also, we dealt with a pretty severe amount of people having to be out or quarantining as things were spiking, people being around family members, customers coming in and then telling us, hey, I tested positive. So the flexibility of the staff was very important. And I think we actually bonded a lot with our staff. I think there were some people that didn't realize I knew how to wait tables or bartend during this whole thing, and were kind of surprised that I actually, knew how to do their job with them. And I think that the one thing that we learned is that listening and being collaborative, even, at every level of the staff was the most important thing that we found, and encouraging people to speak up when there was a need or something that needed to be changed. And it really helped solidify our model in getting through this.
Yeah. So main attribute there for your employees, never underestimate Jared. Is that what I'm taking away from that? Right?
Sure.
Tori, finish us off on that.
Yeah. So over communicating has been a big thing for us, that I think we have just learned that in such a collaborative remote environment, it's really uncomfortable to reach out to someone you've never met in real life over Slack, when you've been on a video call with them a couple of times, right? Especially when you're asking them for help, which is kind of a vulnerable thing. And so there's certainly been a lot of learning curve on the over communication side for us. And I think the second fold of that really mirrors what Renee said, which is as staff, we've had to be really open with students and been really excited to do so because we are doing this for the first time, as are they. And so just being really open to hearing about what their feedback is, not taking things personally, and knowing that, sometimes things don't work out the way you thought they did, but having students come with that attitude of, here's what the issue is, and I want to be part of the solution, is how things have really gotten done around Holberton faster, because there's been a lot more of asking for feedback and help there.
Yeah, no, great point. Well, I have a couple other questions, but for the sake of time, I want to make sure that people on the call get their voices heard. So I'm going to open this up. We're just on the the top of the hour. So if anyone on the call has been holding in a question they really want to ask, please feel free to do so. Unmute yourself and chime right in, or I can read some off in the chat if people are too shy. So speak on up.
Really quick, I think, Renee, I think you maybe touched on this earlier, but we had a question that said, have you seen redesigns of spaces or changes of standard operation procedures that you think will remain permanent or after COVID? You touched on it a little bit, but is there anything else you would want to add to that?
I don't think so. I mean, I think the procedures we built around the telehealth visits, will stay. I'm hoping the physical barriers will come down at some point. But we're also in the midst of some of your doctors may use a software called Epic, and you might be on my chart. We're moving to that software, and they have put in some things in the software. We won't go live until January 2022, but they've put things in the software, like if you're a patient and you're pre-registering and you record a temperature or a cough, it sends an alert to the office so that we know to direct you to maybe a different door. And my advice to the software developers today was, do we want to put this in place for COVID? And I said, we may want to put it in place every flu season. Because,
Right?
I don't know if everybody's noticed, but we didn't really have much of a flu season this year.
We didn't.
Guess why?
Guess
why? Because we were all wearing masks. Yeah, we were all wearing masks. So, I think there's some things, and again, we're just going more and more electronic and digital in healthcare, just like everywhere else. And so I think it's exciting times. But not any more than I think I mentioned most of the changes and operating procedures that we changed.
So this is a personal question for me. So there was a lot of let go of hospital staff and medical staff because of voluntary procedures were down because of COVID. Do you think that even though we're kind of on the downward spiral of COVID, do you think voluntary operational procedures are still going to stay down to a certain point for the rest of the year? Or do you think that people are going to feel comfortable enough to come back and still do those procedures that are needed to be, or wanting to be done, not necessarily needing to be done?
Yeah, I mean, most of the hospitals in our procedure center, we've gone, back up to doing everything. There's still a lot of pre-procedure testing. So, you have to get tested 2 or 3 days before you go into the hospital or have a procedure. But, I think one of the worst things that could happen to, especially Oklahomans, is for us to lose ground on our preventive screening. Oklahoma has some of the worst health outcomes of any of our states. We're usually last. If anybody's below us, it's Mississippi. But we really cannot stand to lose ground on colorectal cancer, breast cancer, things that are treatable and you can survive from if you get checked early. So, I just hope that people will trust the system and will come back in and get those things. And we do outbound calls. I have an employee who does nothing but calls employees and our patients, and we'll say, hey, Dr. Smith wanted me to give you a call and let you know that we haven't seen you in a while and we'd really like for you to come in. Can we make you an appointment? So we do those to try to get people in as well.
Have we always been low on the preventive screening, and why do you think that is?
Always. Oh gosh, do you have another hour and a half?
I mean,
I can do a whole thing on that. I should mention, have a degree in public health. So
overall, it's
my pulpit. If you're curious, go on the Oklahoma State Department of Health website. They have a scorecard on how we do on these things. They use an A, B, C, D, F grading scale. Oklahoma is our D's and F's in almost every area. We do fairly well in childhood immunizations, and last time I looked, we weren't doing too terribly bad in pneumonia vaccine. But we have a lot of work that we could do to make the citizens of Oklahoma lead healthier lives.
Exactly. Yeah, I believe in that. And a really quick question, Tori, have you guys seen of an upward trend since COVID started with the Holberton school, or has it just been kind of steady?
Yeah, we've seen a lot of growth this year. And, you know, Jared, I'm sorry to say this because you just mentioned that, you know, you were having trouble with folks deciding to leave the service industries. We've seen a lot of folks career pivoting, either because they just realized they didn't like what they were doing. They wanted something that had a really great prospect for the future, which, I mean, now more than ever, tech has a huge demand. And then also folks who've maybe lost their jobs or were laid off due to COVID. They didn't have an option to work remote, right? And so in that way, I think we've seen a huge uptick. I think also COVID's really highlighted a lot of the problems with our higher education system that we already knew about and existed, and it just really amplified them. And so when we think about, you know, how people approach higher education, it's not just something for like 18-year-olds anymore that are going off to a four-year university to rack up debt, right? I think what we're going to see over time is this change in people realizing that they have to upskill and reskill, and not maybe through a university system, but through shorter training increments throughout their career, and that they will be pivoting in careers more because there'll be more opportunity to retrain and reskill and do so. And so with that, I think you also see some interesting needs arise, but that's a whole other rabbit hole I could go down. But yeah, certainly I've seen a lot of folks that, you know, have seen this as their opportunity to figure out what's the next step and how technology fits in with that.
Yeah.
That's awesome.
And then I want to say we probably have time for one more question. I want to be sensitive to everyone's schedules. Allison had a good question. Allison, I'm happy to read it off if you don't want to say it out loud yourself. So, all right.
Oh, no, sorry. I'm
Go
here.
ahead.
I've got a baby with me, so I don't want her taking over all the questions. But yeah, no, I was just wondering, I've noticed some things that have come as kind of benefits or positives that, like, you know, being able to connect with people more, or through virtual events. And then I know, Renee, you had mentioned being able to have more people attend appointments that they normally would have done because it was virtual. Is there some other things that you guys have seen that have been like really strong positives for your industry or for your companies because of COVID? Because I feel like it's really good to focus on that stuff of what things we want to keep moving forward that we've learned through this process.
I almost, after getting through this in a year, feel like with the team I've got, we could do just about anything that someone could throw at us at this point. Going into what we expect to be a really busy next 18 months in the service industry, I'd say that we're pretty fearless about, you know, about what's coming up, and actually very much looking forward to the challenge of what we expect to be a large increase in business. So
yeah, I think one thing that's been incredibly positive and uplifting for all of our staff and a lot of our students has been that during this time, higher education has become even more accessible to folks. That's really honestly our mission, and one of our aims as a school is to create a more accessible higher education system. And through COVID, we've seen people who have had the opportunity to think about whether their situation was already predispositioned to be prepared to join the school or not, whether it was part of their plan or not. It's been really incredible to get to sit down and hear those stories about how maybe in a time where people didn't know what they were going to turn to next or didn't know what the next step was, they had this opportunity to retool. And part of the way our students fund their education is not paying upfront tuition. Another thing that's interesting that we offer is needs-based living assistance. And so we're able to help people pay their bills and focus on learning a new skill set at the same time so that they can actually make a change in their life. And that's a that's a pretty great thing to wake up to every day.
Well, with that, I want to make sure we can close this out. Bree, do you want to take us home and make sure we can get everyone out on time? I know we're a little bit over, but apologies. It's very interesting content. At least hope you enjoyed it. So Bree, take us away.
Yeah, no, it's extremely, thank you to Renee, Jared, and Tori for taking your time out of your extremely busy and hectic schedule to talk with us, because this is extremely interesting information that we all, I think, at least I am eager to know, and I'm sure others are as well. And with that, I thank you for, again, sacrificing your time with us, and thank you all for listening in and, you know, taking your time to listen to our speakers and get this information. This is 1 out of 3 of Success series, so make sure to tune in for our second part coming up here in a few months. And with that, I just thank you all. And Stephen, am I missing anything? I don't think I am, but just in case.
You got it. Yeah, I'll echo it. Thank you, Jared, Tori, Renee. Thank you so much for joining. If you have not checked out the other crews on TYPROS.org, I would highly recommend you do that, as well as check out our speakers' bios. And then I'm gonna offer it up just because, again, we talked about it tonight. Reach out to anyone on these calls to learn information. I think we need to be vulnerable. It's a little daunting, but now's the time to come together as a community. So that's what I hope these sessions are about, and take it to heart.
And this isn't just me and Stephen. This is also Monique and Naomi as well, because this is both a collaborative effort between business development crew and leadership and service crew, because we both are very determined to help professional and personal growth for you guys. So reach out to any 4 of us. We're here to help you guys. So thank you again for attending, and we hope to see you soon. We'll hang out here for a little bit,